Welcome back, ladies and gentlemen. It's all about CPHQ. And if you are working in a healthcare professional, the very important question probably everyone is going to ask, are you a certified healthcare professional? Now, the difference between your degree and certification is worth understanding. Degree is something which you acquire from college or university just to get that educational or academic knowledge of any particular line. When it comes to certification, certification basically is that you are an excellent skill holder in that particular field. For example, we are talking about certified professional in healthcare quality. So if you get CPHQ, if you get this certification, this in a way ensures that you are a perfect and excellent member to be the part of the hospitals or clinics quality department. My name is Zishan Ali, and today we are talking about CPHQ. I always say one thing: grow your career and not only the age numbers. This is very important, especially for us in healthcare, that every one of us deserve to be the best in their field, and we want to grow in our field. For example, if you are a nurse, or if you are a pharmacist, or if you are orthoptist, or if you are a doctor, physician, dentist, then you deserve to go up to the administration level, up to the executive team levels, up to the managerial levels. And the certifications are the right key which can lead you to that level. So today, as mentioned, we are talking about CPHQ. So CPHQ basically is how it takes your normal career to a next level. So how to grow in healthcare profession is basically get certified in your specific line, not only CPHQ, but you can target any of the certification. There are many certifications. If you are interested in patient safety, go for certified professional in patient safety. If you are if you're happy with the numbers, go for certified in finance department. If you're happy with the facility department, go for certification in facility department. Same for all other areas, but specifically as we are healthcare professionals, so we will talk about the healthcare only. So what you need to do exactly is go ahead and beyond your daily works. Find your weakness and work towards your strength. Find the right certification for you. As mentioned, if you're a nurse, go for certified. If you're a nurse, go for infection control certification, or go for the quality certification, which is CPHQ. Now, the CPHQ in a way is very easy to get if you have 2 years of experience in healthcare, any field, regardless of quality or not quality. It's very easy. The only thing which makes it difficult is the time management. So, CPHQ exam is like a game, and the key players are you and the time. So they give you total of 140 questions. Among 140, there are 125 questions with marks, and remaining 15 are without any marks. They are just pre-test questions. So the takeaway is keep learning and never hesitate to set a goal. At whatever level or how many years of experience you have at the current level, try to get a certification and you will feel the difference. Okay, so in CPHQ there are categories of questions. So if we talk about those categories, the categories are divided in four broad categories, like organizational leadership, 35 questions will come. Health, data analytics, graphs, analysis of data. You are using these health analytics already in daily audits, but you are not thinking in a way that you are already smart enough to get that certification with the same experience. So questions are designed smartly, but you are smarter, I believe, and you should believe also. The third category is performance and process improvement. Very easy. Patient safety is something which is, like, I will say, it's a sweet on the plate, a very nice chapter, a very nice to eat, a very nice category. You will learn a lot and you will get very easily marks here. Now, talking about the way you need to achieve those questions is that, according to Bloom's taxonomy, there are 6 levels of cognitive learning, and the CPHQ exam is based on three of them. There is recall, there is application, and there is analysis. The percentage is mentioned here. The application is the most important one here. Now, those cognitive levels, when we get recall questions basically test the candidate's knowledge of specific facts and concepts. We have studied these concepts in our degree or during our preparation for the certification. For the application questions, require the candidate to interpret or apply the given information and get the right answer. And the analysis is test the candidate's ability to evaluate, problem solve. They will, for example, they will tell you that you are standing in the facility and suddenly code blue is cold. So, would you run for cold blue, or would you consider safety for your patients around you, or would you, if you're not BLS, would you approach the code blue? So here a very simple thing is that if you're not BLS holder, you should not go for code blue. You should just wait wherever you are and don't rush towards that area, because it may cause hurdle for other certified professionals to reach or to that call. Moving to certified professional by passing the exam. Moving on our next slide, we how we become as a certified professional. It's only after passing the exam. Now the passing exam rate is not very high. It's 62%, which is still very good. And many students, they tend to not to achieve their target in first go, but how to avoid not to repeat the exam and to achieve it in the first go is know what exactly to study and study the right material. So in when we say study the right material, we need to read Janet Brown. This is the official book which you study to get more and more knowledge, which is directly relevant to CPHQ. And then use the time wisely. Use the time before the exam wisely and during the exam very wisely. And practice, and practice. I will re-emphasize, reiterate the same thing, that practice makes you perfect. Now, don't just go for practice in a way that you find the answer and that's it. Find the logic behind that answer, that why that answer is correct and why other answers are incorrect. Now, in exam, they will give you such questions where four of them they are correct in a way, but you need to find the most appropriate and the most relevant answer. This is the only skill which you learn while practice. And practice, as I said, practice the mock exams. You will find plenty of mock exam, and moving forward on my YouTube channel, I'll be sharing more and more mock tests, and I'll show you exactly how you need to approach those questions. So make this habit that when you go for a mock exam or mock test, don't just go for the right answer. Look for the logic behind those answers being incorrect also. So test basically is a mind game running against the time. And you know who is the winner. You are the winner. Good luck, guys. Thank you.